let's talk about porcelain veneers. You may have heard the term lumineers, which is technically a brand name for the general term veneer. A veneer is, kind of think of it like a fake fingernail that covers the front side of the teeth. It's limited to kind of hooking over the edge of the tooth and covering the front side. They can be used to change the position of a tooth somewhat, the shape of a tooth, the color of a tooth. Sometimes the tooth has to be reduced down to compensate for the thickness of the veneer so that it's not placed over the tooth and it looks like it's out here, it's jumping out at you, or the teeth are too big. Sometimes veneers can be done without any preparation to the teeth at all, depending on the position of the teeth. For example, if the teeth are set back somewhat, it certainly doesn't hurt to have a little excess thickness to those teeth, bringing them out more, giving more of a profile with the smile, with the veneers. Sometimes you'll hear what's called a no prep veneer, and those are teeth that are not prepared at all by the dentist. The veneers literally can be put right on the existing teeth the way that they are. There are limited situations where those can be done like that, depending on that tooth position. If you have large teeth, if they're out a little ways, certainly you want to compensate for the thickness of the veneer by some preparation of the tooth. A little bit of reduction of the tooth for the thickness to compensate for that thickness of the veneer that will be placed on it so that those teeth do not look too big. Those veneers are prepared in a lab and they are what we call cemented into place permanently. They do stay on, they are not removable per se by the patient. Once they're placed, they're there. We also call that, some patients call it glue, or they glued on. We call it cement, but yes, that's how those are all placed. You can do a single tooth with a veneer. Some patients have what's called peg laterals, which are very small lateral incisor teeth next to your two front teeth that are kind of peg shaped. That's a good indication for a veneer many times to cover that tooth up, reshape it, make it larger, make it look more normal. You can also do multiple teeth in a row. You can do 8 teeth, 10 teeth in a row. If you're changing a color significantly, usually that involves more veneers. The last thing you want to do is 2 veneers in the front on 2 front teeth and completely change the shade to lighten it up to what would be considered a bleach shade that's very light, because you're going to look like you've got 2 teeth only. You really want to involve the rest of the teeth that are seen within the smile line. Veneers are a pretty simple procedure. Anytime that I am going to deal with a patient's front teeth, I know you do not know me, you do not know my dentistry. I strive very hard to create the best aesthetics that we can. Some dentists call themselves a cosmetic dentist. I don't call myself a cosmetic dentist. I just deal with the best cosmetics I can on every single patient, on every single procedure that I do. I don't necessarily call that some sort of separate thing as far as cosmetics, but it is something I deal with continually at all times. I think that you should get the most aesthetics out of any procedure that you're doing. Anytime that I'm dealing with front teeth with a patient, I don't expect them to just say to me, go ahead and change my front teeth. They cross their fingers and say, I hope this looks good. we make a change, I sit you up in the chair, you take a mirror, and hopefully it's what you expect. I think that's a problem. So with patients that I'm making changes on front teeth, I will do a digital scan of their mouth ahead of time, take impressions of their teeth and make a model. I'll make all of the changes on the model ahead of time, sit down with the patient, hand them their representation of their mouth before and after, and let them look and turn things around and assess it. And if there's things they don't like, I'll make changes to those until we get to a point where it's perfect. It's exactly what they're looking for. And then I can duplicate that. That takes away the fear from the patient of, what's this gonna look like? How good is this gonna look? I would love to take a look at your mouth and see if veneers are a good option for you. There may be a better option. It's certainly something we can assess, determine things ahead of time, make sure that you are comfortable with the direction that you would be going and the end result, and even seeing the end result before you've done anything.